name is Matt Charles. I am a Health and Wellbeing Coach for the Medway South Primary Care Network. So I've worked in primary care for a year and a half. It's something that I'd never considered working in before. I've come from a career working in the press. I've worked with young people in secondary education, and then I transitioned into this role. It's been a real eye-opener for me, working in primary care, working with a GP surgery. Like I said, it's an experience that I never thought I'd have. The training that I was given to enable me to do my role was provided by my employer, a 4-day accredited course that took into account my previous experience working with young people, working with their parents, etc. So giving me an accredited course with supervision after that has enabled me to do that job. I've always wanted to help people of any age, any background, any circumstance. That's always been the binding thread in what I've wanted to do. This particular role has been really interesting for me because not only do I get to carry on working with young people as well, because that's the service we provide to them, I get to work with adults, which is lovely because it gives me an opportunity to work with people who just need that starting point, who just need someone to give them that one-to-one support that enables them to make changes or improvements to their health or well-being. Very much firmly looking at what they can do for themselves. And that feeling of someone having a light bulb moment in terms of that's my starting point, something they've been seeking for so long, is really inspiring. I'm very privileged in that regard. On a day-to-day basis, I'm often seeing people face-to-face within the confines of a GP surgery, up to an hour at a time. That's a length of time, a luxury that I appreciate other sort of teams and other organisations might not have. We get that time to really explore with a patient what it is they want to achieve in terms of their health and well-being, so what their ambitions are, what they might already be doing to meet those ambitions and validating those and essentially giving them positivity and motivation to continue, and help them identify new areas, new goals, new ideas of things they can do. So a typical day for me will involve seeing anywhere between 5 to 6 people in a single session of, like I said, different ages, different backgrounds, and different ambitions as well. So it might be someone who wants to better manage a medical condition. It might be someone who wants to just make lifestyle changes, lose weight, be more active, etc. Or someone who is just struggling a little bit with their mental health, stress and anxiety, for instance. So similar format, hour at a time, really getting to know someone over the course of a length of time as well. So we offer 6 sessions initially. Can go on for anywhere up to 6 months, and in that time people have made incredible changes. So some people come to us with a hyper focus, something that they really want to get under control. A medical condition, for instance, it's I want to get rid of my diabetes in 6 months, and everything they do builds towards that goal. Some people have lots of ambitions, lots of things that they want to do. They've got lots of ideas, but it's hard to construct a plan when it feels quite overwhelming. So our role is to help them literally put it down on paper sometimes and say, right, what's our starting point? How are we going to chip away at this and make you feel better as a result? So some people come in with that real hyper focus in terms of the medical conditions. Some people have a whole broad range of ideas, some of which to the person on the street or to people even within the circles might seem weird. They might seem quite odd or obscure, like you wouldn't prioritise it, but for them it is their priority. And that's what we work with. If it's a priority to them, it's a priority to us. And alongside that, we manage our own caseload, so there's admin required as well, which we take care of ourselves. I work with 2 wonderful colleagues across other surgeries, so it's putting our heads together, seeing what we can do in the wider area alongside our caseloads. So we accept different forms of referrals from people in-house. If you're a healthcare professional within our PCN, you can refer to us. Our referral criteria is anyone with a BMI over 25, which shows the kind of preventative approach that we want to take. There's a large portion of people who fall into that category. So we accept referrals from GPs, nurses, mental health nurses, people who form a wider team where they are talking to patients where there might already be concerns. Alongside that, we do some outreach work as well. So identifying groups of patients who perhaps haven't been to a GP surgery in a while or might fall into that threshold and perhaps don't have as much input as they might want or don't feel that they need. And we take the offer to them. We say, hey, do you want to do this? And actually some of our most, I would say, best experiences in this job have come from those referrals where people were so thankful that they were thought of in some way. And they've come here and we've sort of addressed any concerns before they grew to the point where they ended up on a GP's desk, for instance. It benefits them in a number of different ways. One of the first questions I'll ask someone is, what do you want to achieve out of this? What are your ambitions? So from the very first conversation, we get that opportunity to explore what's important to them and how they want to achieve it. For some people, it's about being healthier, it's about getting some diabetes under control, or bringing cholesterol levels down, or bringing their weight down. For others, it's a little bit more abstract. It might be about feeling a stronger sense of identity, feeling a little bit happier, feeling a little bit calmer, or knowing that despite everything that might be against them in terms of circumstances, they are doing the best that they can. And they walk out of that door potentially with something to do about it. They've spoken, which is fantastic, but they've got an action to go and do. So it can benefit them in whatever way they feel that they would benefit from, really. Like I said, I've not worked in primary care for very long at all. The mere notion of sitting in a GP surgery was alien to me sort of 2-3 years ago. I've been so well supported by the primary care network, the people within the surgery on a day-to-day basis, but I've got silly questions about what X medication is or what this system is on the computer because I don't know this stuff. I have no medical training. But when you're having these conversations with patients, a lot of them understand where I'm coming from, but it's enabled me to bridge that gap. So they've been very supportive. The project is run in collaboration with the local authority, Medway Council as well. So we have the backing of Medway Council Public Health. Again, a brilliant, large team of individuals, different services. So all around on a personal and professional level, I've been incredibly well supported and very thankful for that. For right now, I'm enjoying what I'm doing. I'm getting the opportunity, like I said, for the first time to work with adults really in my life, alongside the young people who we also coach. So I'm getting that opportunity to work with adults who are so appreciative for that help. And I'm getting lots of opportunities to train and develop my own skill set, ground what I'm doing in real thought out models that are evidence informed. So for right now, I'm happy doing what I'm doing. And I think I will remain that way as long as I can still get that feeling that I do when someone walks out and I think, wow, I'm really either glad to have met that person and I really appreciate them being so honest with me, or they tell me about the changes that they're making, and that feels good.